Thank you, Dr. Kim. And now we'll turn our attention to Dr. Jordan.
Good afternoon. I'm Betty Jordan, and it's great to be here, and I just want to thank you all for this opportunity to present to you. Many of you may or may not know my early work with pregnant women and new mothers is from Baltimore City, and I did a lot of work with fetal and infant mortality reviews, so this was an area that was really important to me when I had the opportunity to work with the National Text for Baby program. So I'm really going to speak a little bit about some of our lessons learned and share some information with you from Text for Baby, using that as an exemplar to communicate with pregnant women and new mothers. And so I was very ambitious and put a lot of slides on here. So I will skip a few slides, but they are to acknowledge that we actually have done some rigorous research and have some evidence to share on some of the work that we've done on the program evaluation for Text for Baby. So I don't have a conflict of interest. I came to work with Text for Baby as a nurse. I was sitting on the Association of Women's Health OB/GYN Nursing, and was working closely with the National Healthy Mothers, Healthy Babies Coalition when they really wanted a nursing perspective as they began to develop a relationship and launch the Text for Baby program, which happened back in 2010. So I think we've talked a lot today about why go mobile. So I will just share that this slide not only illuminates that who is using text messaging and have cell phones, but also where they fall in terms of our insurance groups and how they're covered. So there is some data out there that supports text messaging, and really what I'm talking about, Text for Baby does have a mobile app, but it also begun as a program sending just short messages. So I'm really going to talk about the evidence we've collected and the data from our text messaging aspect of the program. There is data to help us support moving forward with text messaging. Colin Lewis did a meta-analysis and published it in 2010, where they were able to demonstrate that there were improved behavioral and clinical outcomes in regards to weight loss, smoking cessation, and diabetic management when using text messaging. We also know that Stockwell and colleagues did 2 randomized controlled trials that also were able to demonstrate that when folks received 5 weekly text messages, they were found to have improved their influenza vaccination rates among low-income urban children, adolescents, and pregnant women. Moniz also conducted a pilot study of 204 pregnant low-income women, but was not able to demonstrate a change in behavior for women who refused a vaccine by sending them text messages. There we go. So in Text for Baby, I know many of you probably know about this program because it has been around since 2010, but there were really critical messages that were developed in the program. And these were the key topics that were addressed in the program. So again, just to give you a highlight, it is Text for Baby is a free service provided by the nonprofit National Healthy Mothers and Healthy Babies Coalition. Johnson & Johnson was the initial funding sponsor, with many other partners involved and other private-public partnerships. It is the largest mobile health initiative, and as of March 14th, I'll update my slide, we have 800,122 English-speaking women enrolled in the program, and we have 46,372 Spanish-speaking enrolled in the program. So we're reaching a a large audience. This, again, is how one would sign up for the messages. It's a very simple way for someone to sign up, and oftentimes that may happen through word of, sharing with a friend. It can happen at a healthcare provider's office or in a clinic, as well as we've also had partners with our community agencies where actually we've had community workers go out and help pregnant women and new mothers enroll in Text for Baby. The content was really critical in launching the program, and so there was a rather rigorous review of the content and some research that came out of it in terms of its readability and reading level. And so all of the content developed was based on evidence-based and in collaboration, close collaboration with CDC. So what exists? We have interactivity that has been infused in the program since its launch. We have 58% of contain additional health and resource information. We have several links that we've also included, and we can evaluate if our enrollees are actually using the links that have been included. We also have phone numbers and resource numbers, and we are able to tell if a Text for Baby user uses a phone. For example, we have food banks, we have domestic violence resource numbers in there, and we've again partnered with several of our national partners to include specific links and resource numbers in the program. We also have links to videos that link out of Text for Baby, for example, to March of Dimes website to talk about a woman carrying her pregnancy to the full 40 weeks. We have messages that allow us to say if our enrollees find the messages helpful or they like them, and if they want more information. And we also now have included quizzes, again, directly related to food safety in pregnancy as well as car seat safety in infancy. So we also included an improved appointment attendance and have included these messages in the platform as well. So the Text for Baby program itself is based on a health behaviors theory, and we have used Doug Evans' model, his mHealth conceptual model of behavior change, really to guide the project and along the way. And so as you can see, we have been able to, through a team of researchers and internal program evaluation, have been able to begin to collect some evidence to support the program. We know that Text for Baby moms are 3 times more likely to feel prepared for motherhood. We also know that Text for Baby showed a positive effect with knowledge that alcohol will harm their baby. We've been able to demonstrate that Text for Baby women with a greater or equal to high school education have positive attitudes towards prenatal vitamins. And we've most recently really tried to rigorously evaluate the importance of vaccinations. We also were able to learn that 74% of women reported learning about a medical warning sign, and 67% reported talking to a provider about a topic that they read in their Text for Baby message. And here are just some of the recent Text for Baby studies that are supporting the model. What kind of data? It is a data-driven initiative, and we oftentimes talk about that back-end data and who can have access to it. It is data that is publicly available. Some aggregate data is available right on the Text for Baby website, but for more specific data, there is a data agreement usage form that needs to be completed. We have enrollment data, we have cancellation data, we have interactive module data that exists, SMS survey questions, and again, some anecdotal evidence that is available. So we did implement a flu module, and I'll just briefly tell you the idea here was that we wanted to know if we could improve the rates of flu vaccinations through using messages for pregnant women and moms with infants. And we recognized that there were some barriers. So in putting this evaluation together within the Text for Baby module, we were able to send out messages. We reached out to 89,000 women, and from that we had responses of 28,609 responded, and then we were able to ask the question, are you planning to get the flu shot? Would you like a general reminder, which would be our usual care, or something more specific? And those folks who were not planning, we asked why. And then we broke that down further. And not to get into the specifics of this study, but I will sort of share with you our general findings. So here you can see we had fairly substantial numbers of respondents to our overall flu module. And then we prepared a rather rigorous statistical analysis. And what we found was that the folks who were enrolled in Text for Baby really did want specific reminders. And I'm going to skip there to also say that we did not have, we did lack some adequate statistical power to really assess some of the differences between the general and the specific reminders. But the key thing that we found is that women who said that they did not get their flu vaccination because of cost, we were able to connect them with somewhere that would give them a free vaccination, and they were 2 times more likely to get vaccinated. And that in itself is going to be a study that will be published this spring. But I think that really shares with us today that if we can overcome some of these barriers, that we can change behavior by connecting these women with care, by using the modality of either a mobile phone app or just a simple text message. We also, within Text for Baby, have been able to connect women to coverage, Medicaid, as well as we've integrated it into the CHIP module. I think my time is up. I think they were my key slides. I did get a little ambitious here, so I will take any questions at the end, and thank you.